Welcome. I'm Peter Vickersland, a professor of civil environmental engineering at Virginia Tech. I've put together this presentation to try and summarize the current status of COVID-19, both for students in my classes as well as for anyone who else might be interested. This presentation is being recorded on the 23rd of March and reflects the situation on that date. Now, as illustrated in this figure from the Financial Times website, the number of COVID-19 cases across the globe continue to increase. The data plotted here is presented in terms of the number of days since the 100th case within any of the different countries and uses a log scale so that we can get all of the cases on one graph. So, a few key points. We see lines in light blue that reflect countries and locations that have employed strict mitigation and control strategies. In these locations, testing is widely available and there are societal controls in place that have helped to control the spread of this disease. We also see China, where this disease originated, up near the top. We see that the diseases, or the number of cases of disease within China, is starting to plateau. Now, countries where we see rapid increases and show no signs of disease abatement include countries across Europe as well as across the US. If we look globally, we see approximately 350,000 cases across the globe and just over 15,000 deaths. In the coming days and weeks, we can expect these numbers to increase and that the various dots that are on this map will increase in size and become more geographically spread. I should note that many of the locations with dots indicating smaller scale outbreaks probably reflect both the lack of testing in those locations as well as incomplete reporting as of today. If we look at the number of deaths that have been attributed to COVID-19, then we again see that South Korea and Japan follow a pattern that differs from the rest of the world. In the US, we've seen a recent uptick in the number of cases, as evidenced by a change in the slope of this data around about day 12. In China, the number of deaths as a function of time has begun to plateau, while we see that it's increasing in most other countries. In an effort to try and make sense of these trends, a commentator named Thomas Pueo has published a couple of articles on Medium.com. I'm going to use those articles to try and help us make sense of the situation and what we must do to address this burgeoning crisis. I'll start with this figure from his article, The Hammer and the Dance. In this figure, he highlights the number of coronavirus cases prior to March 4th, 2020 in the world outside of China. So he's taken the data for China off. And as we see here, South Korea at that point had the largest number of cases, while Italy and Iran were both increasing, but remain well below South Korea. Every place else in the world falls in this box down here at the bottom. If we go forward in time, then we see how rapidly things have changed. First, we see that South Korea has stabilized, and that after March 7th, that it has overtaken by Italy. I'm going to explain in a couple of slides why South Korea has stabilized, but at this point, we see that Italy, Iran, and other European countries and the US all start to show significant numbers of cases. I've specifically pointed out on here the day that Italy went into national quarantine, and note that they still have seen a significant rise in the number of cases within the country. This is actually to be expected since it takes a couple of weeks for interventions to stabilize the situation due to the approximate 2-week time period over which people are infectious with this particular disease. Before moving on too much, I want to point people to the COVID tracking project. This website provides up-to-date information about what is happening both in the US as well as at the statewide level. A key challenge that we face within the US is data reporting as well as data quality. And so this is one website that tries to address that. And that's illustrated here for Virginia as well as West Virginia, where in Virginia, the data has a grade of A, whereas the data within West Virginia is B because of some uncertainties there. So getting back to South Korea, I showed before that South Korea has apparently gotten the COVID-19 pandemic under control. It has done so due to its expansive and well-organized testing program that they put into place immediately after this outbreak started. Now, in addition to their widespread testing, they have also put into place an extended effort to isolate infected people and to then trace and quarantine their contacts. So not only do they take people that are infected, but they also go and quarantine people that they've come into contact with. As this quote from Science Magazine indicates, they have tested significantly more people on a per capita basis than we have done here in the US. So to illustrate this differential, I turned to data from Our World in Data. This is a website that you can find on the web that highlights differences in testing by country. As shown here, South Korea has tested many more people than any place else on a total basis and has done quite well on a 1 million person normalized basis as well, as shown by the data in the lower right-hand corner. So in contrast, the US lags well behind with only 313 out of 1 million people tested within the US. Much, much lower than what we see in other countries. So why is testing important? Well, it's needed to tell us who has the disease and who does not. There are estimates right now that about 60% of the people that have COVID-19 are unascertained, and as such, they do not show any or they show only very limited symptoms of the disease. Those unascertained people nonetheless can spread the disease to others, and we really need to improve testing to detect anyone who has this disease, not only those who are symptomatic, but also those who are asymptomatic. Now, as described in this text from Science Magazine, we do have tests that work to detect SARS-CoV-2. That's actually the virus that causes COVID-19. But getting those tests to people and to laboratories, both here in the US as well as other places, has been hampered by bureaucratic and other challenges. So in addition to the PCR-based approaches that were discussed on the previous slide, there are a number of alternative approaches that are being developed both in the US as well as internationally to try to provide more rapid and field deployable diagnostics. We really need to see whether these alternative approaches are going to be effective or not in the coming days and weeks. So to keep abreast of the rises in the number of cases across the globe, a number of different dashboards have been created that allow us to visually display the number of cases and the number of deaths that are due to COVID-19. This is actually one from Johns Hopkins University that was amongst the first. It's still probably not the best, but essentially that illustrates visually and with data the extent of this pandemic. So going back to Our World in Data, they also publicize doubling rates for the number of confirmed deaths, both across the world as well as for individual countries. We can actually use this data to give us very rough estimates of how well different regions and locations are dealing with the COVID-19 situation. First off, we can assume that the number of deaths are increasing exponentially. There's lots of data that supports that assumption. But it still is an assumption that needs to be verified as we go forward in time. Nonetheless, if we assume exponential growth, then with a few calculations, we can obtain rate constants that allow us to predict the number of deaths we can expect a week from now. So globally, we can anticipate about 4,000 deaths due to COVID-19 on 7 days from now. We can expect little under 2,000 deaths in Italy, 500 or so deaths in the US, and only 10 deaths in China. So the situation in China has substantially improved from what it was a month ago. And we can expect, with control measures in place, that the situation can improve in other places across the world as we go forward in time. So we can actually use these simple calculations to give us an idea where we are going in terms of the total number of deaths. I've added arrows to this slide just to schematically think about what can happen in Italy, what's happening in China, what's happening in the United States as we go forward. So clearly we have a challenge that has to be addressed. Returning to Thomas Pueyo and his thoughts, if we don't incorporate any restrictions in the US, then we really can expect that we would have over 25 million people infected with this disease in this country. And if we don't have controls in place, then we could also expect the total number of deaths due to this disease to exceed 10 million people. All of this was calculated using an online calculator that was developed by Gabriel Go. There's a website that's given here on GitHub that essentially allows you to use a variety of different statistics that we know about COVID-19, the basic reproduction number, transmission times, infection periods, all to give us these numbers. So all of these are reasonable based upon what we currently know about COVID-19 and the way that it is spread. So why is it such a big problem? Well, key issue is that a number of the people that come down with the disease need to be hospitalized. So in excess of 12 million people in the U.S. would need to be hospitalized if we don't have any controls in place. A significant number of those need to actually go into an ICU, and that number completely exceeds the number of ICU beds that we have in this country. So hospitalized patients, ICU patients exceed the capacity for our healthcare system to handle it. So in response to this, there were a number of calls that went out in late February telling us to flatten the curve. The idea here is that not only do we know that we have an epidemic coming, but we want to reduce the height of the epidemic peak. So we have social distancing or other measures put into place to reduce the height of the epidemic peak. So this is what is known as flattening the curve, with again the idea that by flattening the curve, we do not exceed our healthcare system capacity. So why does this work? Well, essentially, social distancing works because it helps impact the effective reproduction number, which sometimes is referred to as the variables R, RT, or RE. So R is an important parameter because it reflects the number of people that a sick individual infects. So for a R value of 1, that person that was sick infects another individual. R value of 2 means that that one person that was sick infects 2 people. So for a disease with R values greater than 1, we have an epidemic, or a pandemic in the case of COVID-19. If R equals 1, the disease is spread everywhere and becomes endemic, so everybody has it. And for R less than 1, the disease ultimately is going to disappear. So for any infectious disease, we can think about R being a function of 3 terms. 1, the risk of disease transmission per contact, or beta. 2, the number of contacts an average person has with a given period of time, or kappa. And 3, the period of time over which someone is infected. Now, social distancing in particular reduces kappa, or the number of contacts a person has, and that in turn leads to a reduction in the R value. So in terms of a response to COVID-19, we can think about individual steps, such as social distancing, that help to mitigate the spread of the disease. Such approaches, some of which are summarized in this table from a highly influential report that just came out from Imperial College on the 16th of March, help us reduce the health impacts of the epidemic, but they will not completely interrupt disease transmission. So mitigation is where we utilize interventions that reduce the health impact of the epidemic, but do not completely intercept or interrupt transmission. If we take all of these approaches and we apply them simultaneously, we can suppress the disease. The idea here is to reduce R below 1 or eliminate human-to-human transmission. So doing this takes a long time and it has great economic cost. So this is the big question that we are facing as we go forward is, do we mitigate or do we suppress? Unfortunately, this same report from Imperial College has established that mitigation alone is going to be insufficient. So by doing nothing, we completely exceed our critical care beds. But all of these different approaches in terms of mitigation on their own are going to be insufficient to reducing the number of cases below the number of critical care beds available. This is data for the United Kingdom, but the same holds here in the United States as well. So the impacts of taking an all-hands-on-deck approach or suppression approach is illustrated here. So by incorporating everything that will allow us to systematically reduce R, the number of infections goes way down, and the total death toll can be reduced substantially. In contrast to the previous graphs where the y-axis was in the tens of millions, now we're talking about tens of thousands. So efforts to achieve this goal, where we've reduced the number of infections, we've reduced the total number of deaths, are underway, but in varying forms across the world and across the U.S. So moving more explicitly to the U.S., the New York Times recently did an analysis of different temporal and spatial impacts of either doing nothing, utilizing a few control measures, or doing things that are much more severe. And essentially, we can think about this as mitigation versus suppression. So with no control measures, we can expect a peak in the total number of cases in late May. With some control measures in place, mid-June or mid to late June, and with severe control measures much later in time. So no control measures as defined by the New York Times is no intervention at all. This is not occurring within the U.S. because we've had a number of widespread efforts to mitigate this disease in place as of March 20th. Some control measures is where we employ social distancing, patchwork of government-imposed limitations to work, travel, and dining out. And then severe control measures where we have strict adherence to social distancing, remote working, closing of schools, closing of restaurants, and eliminating large gatherings. In the U.S., we're somewhere between some control measures and severe control measures, depending on where you are. So to illustrate this impact of these different approaches, no intervention versus some control measures versus severe control measures, we can look at April 1st, May 1st, and June 1st. And essentially we see that all of them have different impacts on different locations due to different factors in different locations and different times. But with severe control measures in place, we can severely restrict the spread of this disease. Now, a point that I want to make is that some states are going to have peaks in their infections earlier than others. And essentially, along the coasts in general, we expect infection rates to be higher more early and then to decline over time. Whereas in some other locations, we're going to have a later peak. So this again reflects geography. It reflects how many cases were present at the beginning of this calculation. But we can definitely expect that the rate of new infections is going to vary from place to place. So to wrap up and actually to return to Thomas Pueyo's analysis, we are really currently in what he refers to as the hammer phase. We're going to rapidly learn about COVID-19 and its disease progression. We're using that information to ramp up our response and essentially address a number of the different issues that this pandemic has raised. So this process is ongoing. We can expect that it's going to occur over the next 1 to 2 months. And ultimately, we're going to get the number of cases way down. But we then have to enter into what he refers to as the dance phase, where we really need to be thinking about what steps need to be taken to keep R below 1. And this is going to include testing, contact tracing, quarantining, isolating. That's going to continue for an ongoing period of time, really till we get this disease completely under control. If we don't do that, then we run the risk that essentially we're going to have a good response initially, but we have a challenge that occurs where we exceed our healthcare capacity because we take our eye off the ball and don't really keep things under control. So we have to be thinking not only next week and the next month, but longer than that to make sure that we have this completely under control. So with that, I will conclude. And if you have any questions or comments, here's my email address as well as my Twitter handle. Thank you very much.